Standard Operating Procedures or SOPs, one of the most used acronyms in Malaysia's response to the COVID-19 pandemic, designed to outline the actions that we as citizens need to take in order to stem the spread of this viral outbreak. In the first week of January, Health Director General Dr. Noor Hisham Abdullah said that our nation's health system has reached its breaking point, with daily infections surging higher and higher. Among those who tested positive around the new year was Darren. When the swab came back positive, he was contacted by the hospital and told to prepare for quarantine. That was the last instruction he was given.
The moment I got the news and the report from the hospital, they told me that KKM will contact me. So very likely that they will send an ambulance to my house and pick me up to a quarantine center. So I get myself ready. I thought they'll be coming like either that day itself or the next day. So I packed everything. I got it ready, but I waited for like 3-4 days. There's no news, no answer, no call at all. I tried to call them, but forever couldn't reach. The line is always engaged. Yeah, I try to call. I try to even they give public a WhatsApp number. I WhatsApp them. There's no reply. So I just didn't care much. I just continued to stay at home, and for the coming like 2 weeks.
With quarantine centers across the country filling up quickly, the government has turned to urge some COVID-19 patients and high-risk individuals to self-quarantine at home instead. Without any contact from the Ministry of Health, Darren remained at home for 2 weeks in his own self-quarantine.
I was quite good in the sense that I didn't feel really unwell. I just had mild sore throat and I lost my taste and smell for about 4 or 5 days. That's it. I stayed in for about 2 weeks. I didn't go at all.
After 2 weeks passed in self-quarantine, Darren's symptoms subsided and he believed that he made a recovery. However, the problem still persisted. Even with somebody finally answering his phone calls, he could still not find any answers.
I contacted them I even contacted Pejabat Kesihatan Daerah. I think like last week and even today, but there's no reply. There's no, couldn't reach at all. And 2 weeks before, when I felt totally recovered, I called them. Finally, someone answered my call and they took my particulars. They said they will follow up with me. I told them that I was recovered. I need a release letter, but they took my particulars. They asked me to WhatsApp them my report, but strangely, no one followed up with me, and that's it. Even last week, I drove all the way to Pejabat Kesihatan Titiwangsa, but there's no proper signage, the place like dead. I tried to call them. Where's the entrance? Where to meet? Where to get there? But there's no one answer. Even today, I went to Pejabat Kesihatan Cheras. Also, they asked me to go to another Pejabat Kesihatan.
Now, as the nation is placed under a movement control order once again alongside a state of emergency to increase the national resilience in dealing with the crisis, Darren hopes that the Ministry of Health can make more information available to the public.
I think Malaysia should send a very strong and clear message to the public what to do during COVID-19 or during crisis. They should have a proper hotline number that is reachable, so that everyone, whoever have problem or need helps, can call in to the number and get help and get guidance. But the problem is a lot of time that we, especially government, give a number or contact a hotline that is unreachable. So there's no point. Yeah. So when people, even though sometimes we have questions, we don't know what to do, we need a clearer direction what to do from the government, but there's no help. So if you provide a proper hotline number, then you should provide also the enough manpower to handle that. Yeah, it's not just a show to people that, okay, I have this as well, but it's not working.
The Health Ministry contact for COVID-19 can be found at covid-19.moh.gov.my/hotline. How do you feel about the information that's made available to the public regarding the COVID-19 pandemic? What questions are on your mind that have not been answered? Let us know in the comments.